So we're back. Up next is Captain Jayson Calhoun, who is going to cover cancer awareness.
So for as long as I can remember, I've always wanted to be a firefighter. It started being born in New York and then being raised in LA. When I was in LA, we were right next to a fire station. And every time the sirens went off, I ran to the door and I ran outside, and sometimes I even chased them. I was very excited about being a firefighter my entire life. In fact, every Christmas, every birthday gift, and anytime anybody ever gave me a gift, I got a fire engine or a ladder truck. That's how passionate about firefighting I was. I absolutely loved it. I knew that it was something that I wanted to do. Moving forward, I started as a LA City Fire Explorer because I got a chance to go to that fire station and talk to them about it. They said, hey, we got a program. I lied about my age because I was only 13 at the time and you had to be 14. I got in and I was there for 2 months and I was so passionate and so excited about the opportunity. Then my mom came up to me and said, Jayson, we're moving to Tucson. I had no clue where Tucson, Arizona was. The good news is that when I finally moved to Tucson, I found another fire department that had the same opportunity. And I started as a fire explorer there. I was a fire explorer for 4 years, and then I got hired at the young age of 18. I had gone through my EMT basic my last semester in high school, and I had a contingent job offer so long as I passed high school. The tricky part was that I almost didn't pass high school because of my EMT basic, so that was tough enough as it is. But I got hired, and I was pretty much raised in the fire service. I spent 7 years there before I had the opportunity, as you can see behind me, to get hired by Las Vegas Fire. Little did I know, though, is that my passion in firefighting would expose me to one of the worst things that ever happened to me in my life, and that was cancer. At the young age of 32, I was diagnosed with a brain tumor, and it was a rare form of brain tumor called clival chordoma. The incidence is less than 1 in a million. I couldn't have won the lottery, right? But I won a brain tumor. I will tell you that now, 13 years in the survivorship, it truly was the best thing that ever happened to me. It completely changed me and refocused me. But today, I'm here talking to all of you about the importance of cancer in the fire service because it is truly an epidemic right now. It is actually exceeding cardiac problems, and only close second next to cancer is PTSD and suicide in the fire service. As you can see, I'm one of 8, and my brothers and one sister who isn't up there, we're pretty much all look the same. We're half Irish, we're half Scottish. We pretty much all have the same haircut except for one that's in denial, and we all have the same body type. But in 2008, where my story started, was after about a 4-year battle of end-stage COPD and being a lifelong smoker, my dad finally passed away and died. It was at the funeral where all of us half Scottish and half Irish guys were getting together and drinking up that I was having the worst headaches in my entire life. I'd never had headaches in my life, and I never understood what that was. And I was kind of in denial about it for a little bit until I came home and I was working on a unit where the captain was a physician assistant and a paramedic. The engineer was a paramedic. I was a paramedic, and my partner was a BSN, a nurse, and soon to be paramedic. And I was telling him that I was having headaches and pinpoint tenderness behind my right eye. Everybody at the same time said, we need to go to the hospital. We need to go get an MRI. See, at Las Vegas Fire at the time, we had a massive cancer cluster. Between 2005 and 2009, we had multiple cancers all at once. And to this day, we still don't know what that came from, but I was part of that. This right here behind me is my brain tumor. His name's Phil. He's not actually the picture of my brain tumor, but this is who I use to kind of distance myself from the fact that I had a brain tumor. Had surgery and was diagnosed that following January after my father's funeral wake, and indeed I did have cancer. Hearing the words, Jayson, you have cancer, were the worst words that I'd ever heard in my entire life. And in fact, for anybody that I mentor now with the Cancer Support Network, it is the hardest thing to hear and to absorb. Part of it's denial. It's denial that I'm 32 years old, I'm relatively healthy, and now I have a brain tumor? How did that happen? I work out. Of course, I occasionally go out and have a little drink, but I eat healthy, and I do what I'm supposed to do at work out, and then at off duty, I work out as well. How am I 32 years old, I don't have any kids yet, I'm not married yet, and I have cancer? How is that possible? How is it possible that I'm 32 with a rare form of brain tumor where the incidence is 1 in a million? How did that happen to me? And in my journey in the last 13 years, and now being with the Firefighter Cancer Support Network as the Southern Nevada Assistant Director and a cancer coach and mentor for them, we're starting to see and understand our data a little bit better, and that's what I'm going to present with you guys today, because it truly is an epidemic and a huge problem. So cancer is the most dangerous, unrecognized threat to the health and safety of our firefighters. It's the #1 cause of firefighter line of duty deaths, according to the IFF. This data has been out there for a long time. In 2013, the Firefighter Cancer Support Network got a grant, and we published a white paper that was crystal clear in showing, almost without reasonable doubt, that we have an epidemic problem in the fire service, and it's cancer. In 2007, the World Health Organization, the International Agency for Research on Cancer, the working group, classified cancer as possibly carcinogenic to humans and called for more research and understanding. They listed it as a group 2B. Group 4 means that it's probably not carcinogenic at all. Group 1, that it absolutely is. Well, June 30th of this year, they changed their standing based on 52 different research studies and cohorts, and they listed it as absolutely carcinogenic for firefighters. That's big news in the fire service. Now we can say without a doubt that being a firefighter, being around smoke, you are around carcinogens, and you are increasing your risk of cancer. 40% of the general population will be diagnosed with cancer. 9% of firefighters have a higher risk of being diagnosed. So simply just being a firefighter increases your risk by 9%. 14%. Firefighters have a 14% higher morbidity rate than the general population because of that. You still don't believe me? I want you to look at this graph behind us. Some of us have been to Colorado Springs, and we've seen that wall, and we've stood in that amazing memorial that's out there. 67% of the firefighters that are on the wall there at the IFF Fallen Firefighters Memorial between 2002 and 2020 have all died from cancer. Not heart disease, not fire and smoke, from cancer. It's not that heart disease isn't important in the fire service, because it absolutely is. And what leads to that is also a lack of sleep. And we'll talk more about why that's important for cancer too. But this is crystal clear that this is an epidemic in the fire service. The data, you can't disprove the data. It's pretty much there. If you look at, since 2002, if you look at those, the IFF database, and even if you're not a statistical genius, if you look at the blue versus orange up there, the blue is the cancer incidence, and that cancer incidence for firefighters is way higher than the general population, just simply for doing our jobs day in and day out. And see, you don't even have to be on a fire to be exposed to those carcinogens. The carcinogens that we bring back in our cabs and in our turnouts, they're still latent. They're still around us. You can still be exposed to cancer and not physically even been on a fire. If we're not using the Plimo vents that we have, and when we back up, that diesel goes right on our turnouts whether we're at work or not, and then we put those turnouts on and we go to work and we're exposed. It's out there. So why is that? Because there's over 200 known chemicals that cause cancer. And some of those are listed behind me. That's a lot, a tremendous amount. Simply stated, where there's smoke, there is cancer. If you don't believe me and you still need more data, behind me is our Las Vegas Fire Department cancer list. The ones that are in yellow are the ones that died in the line of duty. Out of the 9 line of duty deaths that we've had at Las Vegas Fire, 6 have been from cancer. Some of those names are right back on that wall right over behind you if you're in this room. This is only the published list of people that are willing to give me their names and their cancer type that's published up there. Some that aren't up there is another breast cancer, is another skin cancer, and another prostate cancer. They just didn't want their names up there. And this is only a current list. This is a current list from 2002 to 2022. So basically 20 years. And there's a lot more up there than I think we think about. If you're watching this presentation right now and you're hearing me talk and you can't recognize a single one of those names because maybe you have less than 5 years on, I want you to hear me clearly on this. I was that person too at 5 years. And because you don't have a tangible relationship with these people, you think that it can't hurt you. You think that it's never going to be you. But eventually, because we work 10, 20, and 30 years in time, your incidence of getting cancer will go up because of your exposure rate. In fact, the busier in the houses you are, and I've always been at busy houses too. I did my probation at 3, I went to 1, and I went back to 3 for 5.5 years until I came down with my battle and I needed to tap out. The more times you're going on fires, the more times that you're coming back and not changing your gear, washing your helmet, washing your mask, hooking up the Plimo vent, the more times you're not actually showering within the hour of being back, your cancer incidence is going through the roof. And these are simple things that we can do. They're not very hard at all. In 2015, the IFF helped us in creating a fluorescent aerosol screening test. And as you can see behind me is the firefighter before he puts on his gear. As you can see, it's typical fluorescent. You don't see anything big back there. This is modern day firefighting equipment. He was then brought into a room to see how much of that actually penetrates our modern day firefighting equipment. And this was after the test. Anything that's lit up in that bright green is everything that got through. So that would have been the soot and smoke that got through our modern day firefighting equipment. As you can see, you look around the neck, that would be your thyroid and your skin cancers. You look around the ears and the back of the head and that whole head area, that's your exposure to brain cancer. You can see that there's hands and there's wrists, and then moving forward down in the gear, the lower legs and the thighs. That's even today with modern firefighting. So, simply stated, for every 5-degree increase in skin temperature, there's up to a 400% increase in skin absorption. That's dramatically high. We don't really understand that until we get into that. And so how can we make changes about this, right? It comes down to culture. But before I get into that, how many times have we been around some old timer that tells us you look stupid wearing your mask at a trash fire or in a dumpster fire or in a car fire? Unfortunately, those are the incidents where you're getting the most exposure because we run on them the most. We run on those dumpster fires, those trash fires, and those car fires. That's when we should be doing it the most. And in terms of a dumpster fire, think about everything, especially in the downtown area, that somebody throws into a dumpster. You're being exposed to all kinds of stuff. Batteries, diapers. We could go quite on for a while there. So, what can we do? There's modifiable risk factors. Obviously, really taking a leap forward and kind of reducing our tobacco use. If you're a smoker, you're a chewer, you're increasing your risk of cancer by being a tobacco user. Limiting our alcohol intake. And part of this conversation you've heard from the other presenters. Obviously eating healthy, that's a big one. Getting those green nutrients in there to get all those toxins out of you is super huge. Using sunscreen. Skin cancer is a lot more prevalent than people think out there. And then working out and staying fit. That's super important to have not only crews come together and work out, and everybody wants to work out a little differently, and that's fine. All that we care about is that we get out there and we find a physical fitness routine at least once a day to do something. Whether it's cardio, strength, if it's getting on a rower, getting on an elliptical, if you're not much of a runner. I'm obviously not, but I'm a bit of a jogger and I enjoy that. Mountain biking, whatever it takes. Just being active and going out there and doing that. This is kind of a new study and I want you to see that, and it's going to support everything that all of us talked about. So a study published in the Journal of Clinical Sleep Medicine investigated 7,000 firefighters in 66 fire departments for obstructive sleep disorders. And obviously researchers found that 37% were positive for at least one type of sleep disorder. That's relatively huge. But you're hearing me say the same thing that the presenters before me came from. How important sleep is, and it's huge. The study revealed more than 80% were positive for a common sleep disorder. So why is that important? Because in 1996, a researcher out of UCLA noticed, his name was Dr. Irwin, that 42 healthy men that were kept awake between 10 p.m. and 3 a.m. showed a 70% reduction in a cancer-fighting immune cell known as natural killers, those NK cells. Those NK cells float within our bodies, and they literally have the ability to hunt down cancer cells and kill them. But sleep is so important to that, and the lack of sleep that we get in the fire service perpetuates those NK cells from not being there and not being healthy enough. Obviously, in knowing our hot and our warm and our cold zones, the closer we get to our hot zone and our IDLH areas, we need to be masked up. Where there's smoke, there's fire. Now, at the same time, I'm not saying that you can't do your job, and there are times where it's just not achievable to put on your mask at the right time, but for the most part, when we're in there and we see smoke, we should have our masks on. And that's important also for our engineers that may be at the pump panel without turnouts on, and for them to put on their air packs, even in that environment. But I want to take it a step further. You saw the fluorescent test. Even with your air pack on, you're still being exposed to a tremendous amount of your body and skin to that soot. And that soot is where cancer lays. So what can we do? Well, the good news at Las Vegas Fire, and with the help of Local 1285, we have and are close to the top 1% of fire departments that have the ability to prevent this from happening just from the policies and procedures that have been put in. First thing you should do is when you come back from a fire, you should shower within the hour. Our company officers and our battalion chiefs need to make that a purposeful event for our firefighters. When you come back, you stay out of service, you go switch out your hoods, which is another huge benefit that we have, and you go shower. And you take a hot shower that's pretty close to a sauna, and we get that out of our pores. That's phenomenal. Plimo vents. Plimo vents are huge, but how many of us have gone into a fire station and the plimo vent's not even connected, right? Multiple of us have. Now, there are times where the systems are down, but Las Vegas Fire and our Local 1285 has worked really, really hard to get those in our fire stations. Diesel, soot, and exhaust has benzene in it. That is a known carcinogen, no doubt. That's been studied on mice, and it's absolutely true that if you're around diesel exhaust, you're gonna get that. So, the next thing is switching out our gear. Another thing that our department and our Local 1285 has been good at is getting us a second set of gear. I need you to understand that less than 5%, less than 0.05% of fire departments in America have two sets of gear. We have two sets of gear. But how many of us have come back with dirty gear and we don't change it out to get laundered? And what's even sillier about that is we don't even have to launder it ourselves. Most of us that started in the early fire service literally had to take our stuff off duty and go to a laundromat and wash our own gear. For us here at Las Vegas Fire, all we have to do is bag it up, fill out a tag, a cadet comes and picks it up, they launder it or repair it for us, and then we get it back. But yet we don't see people doing that. We don't see people switching out into their second set of gear. Last but not least is our helmets. I know the helmet is a badge of courage for a lot of firefighters, and part of that I'm not going to be able to change. But if I could talk to the 5 or 10 year firefighter that's out there, don't end up with that dirty helmet. That dirty helmet that's full of soot and grit is a walking cancer stick that's on your head day in and day out. Some of our recent cancers that we found in skin cancer is right from where the brim of our helmet is, because guys don't want to send in their helmets to ECMS annually to get washed and laundered. That is just absolutely silly. That should not be a badge of courage. And again, calling on the officers and the company officers within our fire stations, we need to remind guys when our helmets are getting a little out of control that we need to get those laundered. We talked about showering within the hour. I can't tell you how important that is alone. And that would include in training. The OSB that we use at the training props and the roof prop, the glue that sticks it together is formaldehyde. Formaldehyde is a known carcinogen. When that sawdust and everything gets in the crevices of your eyes and up your nose, just know that you're being exposed to cancer. Am I telling you that we shouldn't go down and use OSB? Absolutely not. There's no better training prop than we have. And personally, I think that as For those of us that aren't truckies, we need to be on that roof prop even more. All I'm saying is be more purposeful about when you come back from training to get in the shower, or since we have the wipes in our rig, use the wipe, pick your nose in front of everybody, blow out all that sawdust, wipe your neck, wipe your head, wipe your face, and then when you get back, shower. And I can't tell you how important just showering to limit your exposure is. In the fire stations, we were successful with the Firefighter Cancer Support Network and Local 1285 to get some of our ice machines moved. As you can see, this is where the biggest proof of evidence came from. I walked into Station 1 and I took a scoop of ice in our tumbler and I put it on one of our chief's desk at the time, and I said, let this melt. And I came back in 15 minutes and we both looked inside and I said, you see that oil film that's in there? Yeah, what's that? That's the diesel soot that's coming from the emissions of our rigs. We need to enclose this ice machine that's inside of Station 1. Okay, that was a simple fix, and it was an easy thing to prove. We were successful at doing that in some of our legacy houses, and now with new research and design elements with our fire stations, all of our ice machines are now outside of the hot zone, or where we keep apparatus and where we keep turnouts. Other big stuff. Obviously, no fire gear into our living quarters. I think we've been really good about that. We're posting those signs up there and making sure that nobody does that. Occasionally, we have somebody that makes a mistake and comes inside with that. And also with the support of our department, they've been phenomenal in allowing us to use our tennis shoes inside of the living quarters and not taking our boots inside, which not only exposes us to carcinogens, but hepatitis, AIDS, herpes, and everything else that we're around. There are 12 immediate actions to protect yourself as a firefighter. Number one, obviously, being using SCBA from initial attack through overhaul, which is huge. It's different in overhaul if you have the sky above you and it's present, and I get that our air packs get heavy, especially towards the end of an incident, especially if you've been working really hard. But understand that even if you can't see smoke, doesn't mean that when you're overhauling that you don't have cancer present. And I'm not saying that that always needs to happen, but taking a monitor in there and monitoring for that, the one thing the monitor can't tell you is what's not on your machine. So if your machine's not going off, but yet you're still interior and you still have beautiful freckles of something glimmering in the interior of the home, you're being exposed to some sort of soot or carcinogen that's going in there. So just be smart about that. While on scene, exposure reduction. Another successful thing that happened through Local 1285 and the partnership with our fire department was being able to get decon a priority with rehab. Most of us go through rehab when it's formal, when it's lingering, but most of us are still not good at setting up decon. It was so important that all of our new fire engines have been equipped with the ability to connect a garden hose, have a sprayer, and have the citro squeeze. So when you come out in your turnouts and your SCBA, before you even unclick, the idea is that we're coming to the engine, whichever one we set up for decon, we're getting a quick rinse, we're getting a quick spray, and we're getting rid of almost 80% of the contaminants. We're just not there yet as being something that we have changed culture enough to do every single day. That is rather big though. The wet naps and the baby wraps. We have rescue wipes. We purposely went with those and not baby wipes so that the alpha males don't feel like they're smelling like babies. Okay, we get that. You don't want to use the Lysol wipe or any alcohol wipe, because what that does is it opens up your pores and it actually brings the carcinogens in further. And you want something that's big, sturdy enough that you don't end up with all that white stuff on your head and your face, which the alpha males don't like either. You got to be able to get into the eyes, get into the nose. But how many of us have jumped into the rig and opened up that pack and it's dried out because it's been so long since we used them? We get them, guys, and we're free. Use them. Change your clothes and wash immediately after fire. That should be pretty self-evident, but you would be surprised, and especially with our newer generation, how many people come back from a big working fire and we smell like fire and we smell like cancer, and they go to bed. They don't take a shower, they don't even change their clothes. It's pretty simple change. Clean your PPE and your gloves, your hood. Again, we have the hood exchange, so that's phenomenal. Try not to transport that contaminated material back home with you. Decon the apparatus. How many times we had that big fire and we could smell that fire in our rigs for 3-4 days? That's because we're not deconning it. Keep the PPE out of living areas, which we've been really good. Scheduling our medical exams is huge. The importance and the partnership between Local 1285 and our fire department and having the ability to have a medical exam annually. And just so you know, anybody that's in Local 1285 covered under that group, including dispatchers and prevention, are allowed to go down there and have that medical exam too. That has been astronomically important in preventing cancer from us. I can't tell you the number of cancers that have been found at the very early stages by an annual checkup. It is huge, 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 huge. Don't use tobacco products, and obviously use sunscreen. In terms of the Firefighter Cancer Support Network, what we really do is we go out of our way to educate and advocate, but we also provide badge-to-badge support. So if somebody comes down with a cancer type, we try and pair them with somebody that's had a similar type of cancer to be a cancer coach. We don't pretend to be, clinicians, and we are certainly not clergy, but all we typically are is another firefighter that's had your type of cancer, and we can provide that support for you and the questions that come from there. We can also send you a toolbox. In that toolbox, it has a whole bunch of information in there in survivorship and in looking at stuff. Probably the most important thing that you'll hear for us is if you get the diagnosis of having cancer, it's critically important that at the very least you get a second opinion at a National Cancer Institute. That is super, super important. Moving forward, in talking about culture and the change, this is the most critical thing in the fire service right now. We have to be able to look at our behaviors and look at our perceptions and our attitudes and our values and our beliefs about having dirty gear and a dirty helmet as that badge of courage, or that physical reminder of how experienced we are in the fire service. And we need to change that, because that's what's exposing us day in and day out to fire. And in fact, we need to change it to where the guy with the cleanest stuff is the coolest guy in the station. I know that's difficult, especially for people that have less than 5 years on, because that's our biggest onboarding in the fire service. The other thing that we need to allow us to do, and while the importance of a kitchen table in the fire service cannot go in any way underestimated, because in truth, when most people retire, that kitchen table talk is important. But you've heard from other presenters today that you may have to do a meal replacement or find something better diet that works for you. Why can't we incorporate that into our everyday meal? Just because they're on a diet doesn't mean that they forget that their most important time is family time with the rest of the fire service. Don't give them crap for that. Everybody's on their own plan, their own path. Let them come in. We need to sit together. We need to encourage that better behavior and moving forward. But again, that normalization of deviance, and that's a big word. It was coined by NASA. It's from deviating from our known safety protocols. We gotta change the culture when we walk by a primal event that's not connected, that we automatically think we need to connect that. We need to go out of our way to gut check each other about washing our gear and going to our annual physicals. We need to gut check each other, and don't even give it an option when we come back from a working fire that we walk around with the clean hoods and throw them at each other, so that there's no other way other than doing that. And then as company officers and battalion chiefs, we have to provide the time for those, especially in those busy crews, to go and shower within the hour. This is me on my last day of radiation or my graduation. Because of how rare my cancer is, I was exposed to about 9,000 R of radiation over 40 days. I'm 13 years in the survivorship, and it's not quite over yet. While I've survived my primary cancer, I'm actually more at risk for my secondary cancer from the radiation. Don't know when or if that'll ever happen. I still have checkups about every 2 years, and understand for those peers that are around you that have cancer and going for those checkups, the PTSD that you get from going to a checkup and worrying about the fact that you're gonna have cancer again is real. My family, my friends, and especially my wife know that the week that I go for my 2-year cancer checkup, I'm just off. And it is what it is. The radiation in my Pituitary gland created some hormonal issues, and between balancing and trying to fight my cholesterol and finding where a happy place is in my testosterone, I'm still having problems there. So the reason I tell you that is because even if you fight the battle and you're successful in the battle, you will still have problems with it for the rest of your life, and it'll always be there. So why not eliminate the risk and do what we can do now in preventing it from ever happening? That's all I have for you today. Thank you for your time.
Jayson, how do we activate the Cancer Support Network? If somebody comes down with cancer,
Right. So the question was, how do we activate the Firefighter Cancer Support Network? There's a couple ways. In each fire station, you should have my card and or the 8.5 by 11 sheet that shows where you can actually get help. You can go online and Google Firefighter Cancer Support Network, and under there's the resources to reach out for a cancer mentor and also a phone number to call in the event that you need help immediately. You can also reach out to me and call me, and I can get you started that way. Cancer's different for every single person. Some people really want to be private, and some people want to be completely open of it. We can provide whatever level of support that you want. Sometimes people don't want me as their cancer mentor, and I get that because I'm an officer at their fire department. Sometimes they don't want anybody in the valley to know because they're that alpha personality that doesn't want to ever show weakness. That's okay. We can get somebody from out of state. The biggest thing is that we get you a toolbox and we get you set up with best practices and what's done there. And we'll get you a mentor from anywhere in the valley and help you out there. That's a great question. Thank you. All right. Thank you for your time.